Welcome to Dr. Shahid's forum for prevention of chronic pain, prevention of chronic diseases, and how to achieve a state of well-being. Today, my topic will be about pain. You know, so many people are in pain. If you just take 100 people out of the street and ask them, you will find that at least half of them will have some kind of pain in the last 1 year, severe pain. And there are so many millions of people living with pain. Now, people sometimes tell the statistics about it, but I want you to focus on how you can prevent your acute pain into chronic pain. Now, what is acute pain? Acute pain is when you have some kind of injury to the tissue, to some part of the body, and that message goes to the brain that there is something wrong. That is acute pain. For example, you are going at home and there is a sharp nail or sharp thorn and your foot comes on it, so immediately your body perceives that pain, and because of the pain you automatically, reflexly move your foot away from that sharp object. So that was acute pain. Acute pain could be because of the inflammation. Acute pain could be because of the degeneration happening very quickly, some trauma. The issue is that we have to limit that acute pain. We have to break the pain cycle, manage it adequately. Otherwise, it will or can be converted into chronic pain. Chronic pain, any pain more than 6 to 12 weeks is chronic pain, especially more than 12 weeks, 3 months is chronic pain. So 6 weeks is acute and 6 to 12 is subacute, and then is chronic pain. And the chronic pain also results in exacerbation of acute pain. Now, what exactly is pain? Pain is a subjective sensation. Subjective sensation that is unpleasant, which has an emotional component in it. Now, if you combine these things, that is a sensory thing. That means somewhere there is a perception or real threat to the body tissue that was detected by a nerve, and that pain fibers carried this information to the brain passing through different centers. One center is emotional center, the other center is the sensory center. So we can find out where the pain is and where it is being referred. So pain is, even though it's a subjective sensation, it is unpleasant. Why it is unpleasant? Because the body intelligently telling our brain that there is something wrong, fix it. And if there is no pain sensation, what would happen? I mean, we would like to have no pain, but if there is no pain sensation, what would happen? Actually, it's injurious to life. We may not be able to survive. Those children, those infants which are born without any pain, ability to perceive the pain, they most of the time do not survive more than 1.5 years. So pain in a sense is actually a blessing, is actually a useful thing to inform us that there is something wrong. The problem is that we may not pay attention to it, and then it can convert into chronic pain. Once it informs that there is something wrong, then we have to address it. So addressing the pain actually prevents converting into acute to chronic pain. So acute pain, how you can address? Naturally, people take anti-inflammatory medication, people use cold. Acutely cold is very useful than heat. The first 24 hours anytime there is an injury, you may want to use cold. After that, heat is useful. The purpose of both cold and heat is, these are physical modalities, increase the blood flow to that area, and once the blood flow is quicker, it accelerates the healing process. Like we know that if there is an injury to the face, it heals very quickly as compared to injury to the shin, because the face blood supply is very fast. So healing occurs where there is more blood supply. So by applying the heat or cold, we can improve the blood flow to that tissue, and that can increase the healing. There are many other ways to combat that pain. First of all, we should know that pain is not bad for us. It is just to inform us. Once we are informed that this area is threatened, we address it. Now we don't need actually pain. So controlling the pain in acute stage, even by using sometimes narcotics, is a good thing because it can break the pain cycle. Now remember, what is pain? Sensation carried by nerves. If there is a continuous firing of the nerves become well educated, the nerve become efficient in carrying the message. So you feel more pain, which we call that the nerve's threshold has been lowered for pain. If a normal nerve has to have a 50 newtons of force to cause pain, now it may cause pain on 5. That's why those people who live in chronic pain, they become vulnerable. And the chronic pain actually does not limit itself to those neurons which are being fired. It also takes the help of the other surrounding neurons. And that's why in the beginning, maybe the pain is going in certain areas, and later on it can spread to many areas. And it does not really explain that injury very well because of its spreading diffusely to the other part. So when you go to the doctor, he is going to ask about where is your pain, when did it started, where does it go, does it stay there locally or it goes somewhere, how it gets relieved and how it gets exacerbated, what position of the body makes it worse. So all these questions will be asked, and you should actually know these questions beforehand. So if you are well informed, going to the doctor can save you some time to focus on the treatment part. So in today's world, basically understanding your body is the best way, and moreover it's a miracle of the word. I mean, if you ask me what is the best miracle in this world, it is our body. And any function or dysfunction actually gives us an opportunity to do self-reflection, to look at ourselves. So most of the time I ask my patients, if you have this pain, this gives you an opportunity to look at yourself. Because most of the time we forget ourselves. We are so busy in our studies, in our career pathways, in our work, with our families, with so many projects, that we forget ourselves. No, pain is also a blessing that it reminds you your physical presence. And remember, the body, the physicality comes first. No matter whatever part of the system you want to improve. You want to improve somebody's behavior, you have to start with the body. You want to improve somebody's spirituality, you have to start with the body. You want to improve somebody's intellectual, you have to start with the body. So the body is something which we have the best machine in our possession, and pain actually reminds you to look at that, reminds you to do self-study, and reminds you to get into yourself, to look into yourself deeper. So in a way, pain becomes a blessing, and we have to just answer to its protest, answer to its shouting and yelling, and sometimes being very unpleasant, we have to respond to it appropriately.